What are communication options for laryngectomy and employment? Imagine losing your voice and still needing to speak clearly at work. It might seem tough, but there are many ways to communicate effectively after a laryngectomy. When the voice box is removed, the natural voice is gone because the vocal cords are no longer there. But that doesn't mean you cannot talk or work confidently. There are several options to help you communicate in daily life and in the workplace. One common method is tracheoesophageal speech, which uses a small device called a voice prosthesis. This device is inserted between the windpipe and the esophagus. When air is pushed through it, it causes vibrations in the throat that produce sound. With practice, people can shape this sound into words. This method often sounds more natural and is popular for work situations where clear speech is needed. The device needs to be checked and replaced every 3 to 6 months, and the cost can range from $500 to $1,000 depending on the healthcare system. It usually takes a few weeks to learn how to use it well, but many find it very effective. Another option is the Electrolarynx, which is a handheld device that creates vibrations. When placed against the neck or cheek, it produces a robotic voice. The user then shapes this sound into words with their mouth. This device is simple to operate and can be used immediately after surgery. The cost is generally between $200 and $500, and batteries last for about 10 hours of use. While the voice sounds mechanical, it allows quick and easy communication, especially in busy work environments. Esophageal speech involves swallowing air into the esophagus and then releasing it to create sound vibrations. This method requires training with a speech-language pathologist and can take several months to master. Once learned, it allows hands-free speaking without external devices. The main challenge is that not everyone can develop this skill, but for those who do, it offers a natural-sounding voice suitable for many jobs. In some cases, nonverbal communication becomes necessary, especially during recovery or if other methods are not feasible. Writing notes or using smartphones and tablets to type messages can be very effective. Communication boards with pictures or symbols help convey ideas quickly. Voice banking is another option, where a person records their natural voice before surgery. These recordings can then be used with speech synthesis technology to generate speech later. These tools are especially helpful in work settings where quick and clear communication is essential. From a speech therapy point of view, choosing the right communication method depends on the person's needs, job type, and comfort level. Speech-language pathologists assess each individual and provide training to help them use devices and techniques effectively. They also help with practicing speech and understanding how to communicate confidently. When considering employment, it's important to think about the type of work. Jobs that requiring frequent phone calls or verbal interaction might benefit from tracheoesophageal speech. For roles with less speaking, electrolarynx or nonverbal methods may work well. Employers and coworkers can be educated about these options to support effective communication. Sometimes, simple adjustments like using a microphone or written notes can make a big difference. Overall, the goal is to find a communication method that fits the person's lifestyle and work demands. With the right tools, training, and support, individuals can speak clearly and confidently, maintaining their independence and success in the workplace.